Well, if you're looking to straighten up that smile, well, Dr. David Maloley from Vail Valley Dental Care can help you. We're talking about Invisalign today, and this is a fabulous new technology. Not so new, it's been around for a while, but people are really starting to take advantage of it.
Exactly. I think just like anything else, technology helps make our lives more comfortable and easy. And Invisalign is a take on traditional orthodontics in that it's moving teeth into the position we want them, but it's new technology that allows us to virtually create models that a patient can see the point A, point B, the final product, and then they've done over 1.3 million cases, so they know predictably how quickly teeth will move and that sort of thing, so that we can decide course of treatment, best mode of treatment, that sort of thing.
And the Invisalign, instead of the braces that can be a little painful to the mouth and be very visible, this basically is that invisible look.
So what Invisalign does is manufacture these clear trays that they call aligners, and it's a series of those that gets the teeth into the position we want them. And the comfort and the transparency that you mentioned are the two of the big benefits that they have.
Okay. Yeah, they're so lightweight, but yeah, they're a little more rigid. I have these for teeth whitening, but yeah, those are more of a kind of a rubbery
Flexible.
plastic. So now, is it true that you start with one tray and then you progressively go to different trays that work with moving the teeth?
Right. So Invisalign will manufacture the trays, and you'll wear each pair of trays for 2 weeks. After 2 weeks, you'll have another set. So you'll see me roughly every 6 weeks to make sure that we're still on track.
Okay.
But that's the method, is to keep those trays in. Essentially, when you're not eating or brushing your teeth, you want them in. So a minimum of 20 to 22 hours a day.
And they look like they're very easy to take out, and really they're not that noticeable when you have them in.
People get used to speaking with them. You, of course, take them out when you eat. It makes, as opposed to brackets and wires that we had talked about, it makes the teeth much more cleansable. You can take them out, brush, floss, and keep the teeth really healthy while they're getting in the position that we want them to.
Now, who's eligible for this? Would kids do this, or would they do more traditional braces and adults go this route?
The technology is advancing to have an Invisalign teen product. Typically, in my practice, I would refer that to an orthodontist when somebody is growing and developing. But any adult who, once we say in dentistry, form follows function, needs straighter teeth for function, for a more comfortable bite, or better cosmetics, then I think Invisalign is something worth a discussion.
Okay. Now, what are the benefits of getting your teeth straightened? Is it just cosmetic, or are there some medical sides to it?
I will say that most people that have a chief concern with crooked teeth, their drive is to have a more beautiful smile. And it does look fantastic when teeth are straight and white.
Yeah.
Nice and natural and a beautiful smile. But there are other advantages as well. Having teeth straight is healthier because crooked teeth are harder to clean, more likely to have periodontal disease. Also, I see a lot of people that cause undue destruction to their teeth and bone because their teeth just create undue forces. They're not in the position that they're designed to be in. So not only is it more cosmetic, more healthy for the gums, but it creates more longevity for the, if you wanted to keep your teeth for a lifetime.
Okay. And now, if we want to come in for a consultation, we can do that. Do that free of charge? Free
of charge, no obligation consultation. We can introduce you to a variety of things that may meet your chief concern. But I think if your question is, can my teeth get straighter? Can I have a more beautiful smile? Then Invisalign is certainly a point of discussion that we'd want to address.
Okay. Does it hurt?
That is a very common question, and to say that it hurts, I think, especially with Invisalign, there's some tension there, especially when the new tray goes in, because the teeth are advancing and that tray is more tighter than the last one was. But I think overall, considering we're removing teeth through bone, this is a very comfortable product where the brackets and wires aren't going to abrade the lips and cheeks and a common complaint that adults have with traditional orthodontics.
Now, once you reach your desired alignment, let's say maybe 6 months goes by, it gets a little shifted, would you just put the last tray you used back in, or kind of do a little maintenance at that point?
That's a great question. So anytime we do orthodontics now, we know that we have to be married to some sort of retainer because teeth will shift.
Yeah.
So either we deliver a retainer that's very similar to this that a patient would wear nightly to keep the teeth in position, or we could do something bonded that's permanent so that compliance wasn't such an issue, something that stays in there like I have in my mouth as a wire behind my front teeth.
Okay. All right. Well, exciting news. And you know what? To have that beautiful smile and to be proud and want to smile, that's a life enhancement too.
When you talk to patients who have gone through this, confidence is always a word that comes up in discussion. So you're exactly right.
I can imagine that no one complains about paying for it after they're done and they see the results.
That's right.
All right. And you're located right in Avon?
Avon Center Building. You can call us 970-949-3331 or check us out on the web, vailvalleydentist.com.
Okay. Thank you, Dr. Maloley. We'll be
you.
right back.